Well, if you found your way here, you probably know that you are at Connecticut's Affordable Housing Conference. Excited to be here at the end of our last day of a great wealth of information and speakers and perspectives and expertise. It's been so exciting. As you probably also already know, the conference features local, state, and national experts leading conversations, exploring challenges, sharing best practices, and coalescing us around critical next steps to address key affordable housing issues in our state. This year's conference is focused around building stability, and each session spotlights a unique approach to strengthening housing stability for households and communities across Connecticut. We've been live tweeting the last few days, and we are still doing so at using the hashtag CAHC 2022, and you can find us on Twitter at PSC Housing. The session we are now about to kick off is Housing as a Platform for Health, How a Children's Hospital Impacts Safe and Affordable Housing. Before we begin the conversation, I want to thank our leading sponsors, the Department of Housing, Connecticut Housing Finance Authority, La Rosa Building Group, Melville Charitable Trust, Wells Fargo. And that is it for our leading sponsors. Thank you so much. We could not have done this conference without you, and your support means everything to us. Same goes for our collaborating sponsors, Bank of America, Hartford Foundation for Public Giving, Key Bank, Rockport Mortgage Corporation, and Webster Bank. We appreciate your generous donation and support for the conference this year. Similarly, for our armful of friends and supporting sponsors listed here, as you can see, always grateful, and thank you so much for supporting this year's conference. This session is in particular sponsored by Connecticut Children's and the Universal Healthcare Foundation of Connecticut. So thank you so much for sponsoring this conversation today. Before we kick it off, just a few quick housekeeping items. This session is being recorded, and all recordings are going to be made available to our YouTube account, PSC YouTube account, as soon as possible. You all have entered muted as participants. Please remain on mute unless the speaker has asked you to unmute. If you do have any technology issues, you can reach myself, Danielle Hubley, or Carlene Charmelis, PSC staff on hand to help if you run into any trouble or you have any questions about anything. Don't hesitate to reach out. We'll do our best to assist you. And your speakers will let you know how they would like content questions to be submitted. At the end of this session, you can complete a session feedback survey by clicking on the megaphone icon in the corner of your screen in the lobby. We super appreciate your feedback, so please take a quick moment to fill out that survey. It's only a couple questions, so we appreciate your feedback and input as we prepare for next year's conference and think about that in the horizon. One last thing is that our housing data profiles have been updated on PSC's website. You can access the latest housing data for all of Connecticut's towns and cities in an online and interactive format. Each housing data profile contains a summary of important housing data in your town, and you can get the fast facts on affordable housing or do a deep dive into the distribution of your city's housing costs. We'll drop the link in the chat, but with all of that great information, I am so excited to hand it over to Scott and his team for this wonderful conversation.
Well, thank you, Danielle, and welcome everyone. I'm so extremely excited to be here and talk with you today about some of the work that we're doing at Connecticut Children's. My name is Scott Orsi, as I was introduced. I am a senior director at Connecticut Children's. I work in our Office for Community Child Health, which oversees all of our community-oriented programs. We have 17 programs that we oversee here, and one of which is our Healthy Homes program, which you're going to learn a little bit about today. Our conversation today is really thinking about how we are thinking of housing as a platform for health. So you're going to, for the next hour, have a lens of health to the housing piece. We are looking at creating safe, affordable, quality housing through a program that we're calling Building for Health, and we have a number of folks here to share that information with you today. So, Albert, you want to move to the next slide here? Oh, and also I should mention that throughout the conversation, if you do have a comment or a question, feel free to pop it in the chat. There's a number of us on the line here, so we'll try to address questions through the chat. There will also be sort of a panel at the end, which we will talk about, then we will have an opportunity for some additional questions and answers. So let me just share with you who's on the line today. So as I mentioned, my name is Scott Orsi. We also have Chris Corcoran, who's the manager for a Healthy Homes program at Connecticut Children's. Alba Cruz is a program coordinator within the Healthy Homes program. She is the heart and soul of our work related to this Building for Health program, and she will be sharing with you a lot about the program and how it relates to our partnerships within the community. We also have Luis Rivera, who's our community relations manager, and as we will talk about our goals of promoting children's health and development cannot be done without partnerships, and we take Luis's role incredibly seriously. He helps us facilitate conversations across all sorts of partnerships within the community, and he will be facilitating our panel discussion at the end. We also have Jim Horan, who many of you know as the executive director of LISC here in Connecticut. LISC is actually the brain trust behind Building for Health. They proposed it and piloted it, and we just recently, about 5 months ago, took over the administrative work of that. So he's here to share his perspectives on the pilot and the launch of Building for Health. And Pam Wolf, who is a really critical, important partner of ours, one of the partners, one of our strongest partnerships, as you will find when we're talking through this, is with the weatherization vendors within the state of Connecticut. And HE Energy Solutions has just been an incredibly good partner and stuck with us through thick and thin through the piloting and the launching of this program. And Pam will share her perspective as well. So, Alba, next slide. So I thought it might be useful, and I'm just going to speak just for a few minutes, and I'm going to get to the folks who really know the program backwards and forward. But I thought it might be useful for me just to frame a little bit of why Connecticut Children's is here today at an affordable housing conference. And I keep this quote in my signature on my email. Dr. Paul Dworkin is the Executive Vice President for Community Child Health at Connecticut Children's. He was a long-standing physician-in-chief at the hospital as well. And he posed this quote, this question about, well, actually much longer ago, but it is our founding question of the office. What if our goal for child health service is not merely to treat or even prevent childhood diseases and disorders, but is also to promote children's optimal healthy development? And if you take that question seriously, you quickly come to the conclusion that good quality healthcare, while important, only represents about 10% of healthy outcomes for children. Other things such as the environment, their social situations, their behavior, their genetic makeup are the other critical components of how health is done. So we cannot do this work alone, and that is why we are here. Alba, next slide. One way that we like to represent this concept is through this diagram, which we call our flower diagram for obvious reasons. And obviously through our lens, we place children's optimal healthy development at the center of that. But I encourage everyone here to think of your own organization and the goals that you may have, and place that at the center of the circle. And you will find probably that a lot of similar sectors will be engaged in that work. When we started this work maybe 20 plus years ago, we obviously sit within the child health services in that purple area. We also have good relationships with family support and early care and education, because that is kind of the space that we engage in. But you're right, but we know that all of these other sectors, including housing, which we're talking about today, but transportation, even arts and culture, faith, all of these areas are critically important. And I know that through my engagement with Partnership for Strong Communities, I know that housing also leads in this same sort of thinking about the intersection of the different work that we're doing. And again, that's what we are interested in. We refer, within Connecticut Children's, we refer to this as our all sectors in approach to our work. And we are always looking for critical partnerships across different sectors that may be able to promote health in ways that we are not experts in. Next slide, Alba. So we are not alone. This is just a couple, a little pulled from an Urban Institute review a few years ago. I just share a couple of these that demonstrate that other hospitals, many hospitals are involved in housing investment. So you will increasingly see housing often referred to in the lens of like anchor institutions or things of that sort, but housing being a critically important piece to health. Other hospitals have taken a major role in that as well. Alba? So for us, what is healthy housing? Healthy housing is quality housing. And we will talk about just in a minute our Healthy Homes program, which focuses on improving the quality of housing. We also think very much about stability of housing. We know that leads to health with families and children. And we also know that affordability is critically important. Alpha. So the Healthy Homes program that I've referenced, which Chris Corcoran leads, is a program that we have had since the very founding of Connecticut Children's 25 years ago plus. This is a program that is direct service to homeowners and leverages HUD dollars, federal dollars, as well as state dollars to assess homes for health-related risks. And predominantly when we think about children, we're thinking about lead and mold, which might lead to asthma and those sorts of exacerbations. But we also have asbestos, radon, trips, falls, any kind of health hazard within the home. We help homeowners assess those risks. We develop scopes of work. We can coordinate with contractors. We work with residents to get out of the home so that the work can be done. And we seek and help homeowners get the funding needed to do that. Average intervention for us is about $12,000 per home. This program has serves between 300 and 350 families at any one time, and we might have 100 across maybe 150 properties across the state of Connecticut. So that gives a little about where we're starting and why we're here. But what this Building for Health initiative really does is helps us achieve one of our longer term goals. And that is from remediating unhealthy homes as we're doing today and as we've done in the past, to really ensuring that children live in safe, secure, and stable housing. And cross-sector programs like Building for Health are critically important to that end. And for that, I would like to hand the reins over to Alba to take us through the details of the program so that you can learn a little bit more about that. So Alba.
Thank you, Scott. So actually, Building for Health, I just have a little activity for you guys. So those of you that can, if you are able to go to slido.com, you can enter this code, or if you are on a phone, you can just scan the QR code right over here, and it will actually lead you to slido.com to answer a few questions that I have. And again, I'll just keep this up here until some individuals can go on. And one of the questions that we have here is, I don't know why that says that. Is what are some outcomes that can result from safe and secure, stable housing? So if some individuals can just type in what they think are some, say, outcomes from results from safe and secure housing, please type in. Better health for residents. Economic stability, improved health, illness, better health, healthy living, comfort. Yes, no, these are all looking really great. Financial security. Financial security is a really big one. Good psych, stability, better mental health, reducing of stress, yes. Better education outcomes. It's really good. Financial independence, yes. Comfort and financial security and better education outcomes are being pretty big ones right now. Less worry, success, strong communities. These are all really good. Health, improved performance. Psych. These are all really good. All right. And another question that's going to pop up is going to be kind of in relation to this. But what do you guys believe are some barriers for families in obtaining community resources? Transportation, knowledge of resources, yes. Language barriers. Language, yes. Language is a huge one. Awareness of resources out there. Lack of trust, time, discomfort. Being unaware, yes. Being afraid to ask, yes. Too busy to research. Outreach of materials, immigration. Not eligible for the program. Procrastination. So I'm saying like the core theme being language, transportation, and overall awareness of resources out in the community. So we're gonna let a couple more answers come in. Childcare. History of failures. Okay. These were all really good answers. Just want to make sure I don't miss anything else. Shame. Stigmas. These were really good. So this actually leads into my conversation about building for health. So let me just. Okay. So with building for health, we're actually going to go through the journey of building for health. And I know Scott talked about some of it, but the building for health actually started with LISC, with the support of the Hartford Foundation. They were able to launch a 3-year initiative in 2019. And the purpose of this was to create an innovative place-based, no wrong door system level approach. And with this came building for health. So building for health included an integrated one-touch survey to identify residents' priorities and link homeowners and families to services addressing those priorities or needs. The project did end in June 2022, but like Scott had mentioned, the Healthy Homes assumed administrative oversight of this innovation. So an overview of building for health. The One Touch platform is a cross-referral system. It allows multiple referrals to be made for the family. We obviously need the family's consent to make these referrals. But with this referral system, we're able to ensure the family is receiving any support that is missing or needed. We are continually working to expand referral partners, and this can include the city, community development, finance institutions, as well as community-based organizations. This is an initiative where we have seen success, and advocating for policies and funding to sustain this impact is extremely important and vital. And one thing that we have seen with the One Touch platform is how great it is seeing this partnership benefit families. So for example, seeing a hospital like Connecticut Children's being able to collaborate with a weatherization program, the families that we're seeing are in a home that is safe and secure. So this is some of the partners that are part of the One Touch platform. We have the Waterbury Department of Public Health and their Healthy Homes program. So they're able to provide financial assistance to address lead hazards to homeowners where the homes are located in Waterbury. They conduct a comprehensive lead risk assessment, provide relocation assistance if necessary, and conduct lead hazard educational materials to homeowners and families residing in the property. We also have energy programs within our platform, them being CMC as well as HE Energy Solutions. They are able to conduct home energy assessments, provide families with energy saving solutions based on that assessment. And what that leads to is being able to help them reduce energy costs, and provide comfort for families within their own home. The Connecticut Children's Healthy Homes program is also a partnership. I won't go too much into detail because Scott had already spoken about our program. But another partner that we have is Putting on Airs, and they are an asthma self-management program. So they work with families to identify and reduce asthma triggers in the home and help control asthma symptoms. So this quote was by one of our previous relocation education coordinators from the Healthy Homes program. And here I really liked it. She's stating, families, they feel like they're being heard and respected. They no longer have to simply put up with challenging living conditions because now they know what there are options available. And that is really what the One Touch survey is all about. With this, we're able to go above and beyond in addressing the needs of families and be able to explore how to improve their living conditions and connect families to options that they may not have known were available. So I know in some of the responses from the audience, they mentioned knowledge or lack of awareness. So with this One Touch survey, we're able to bring more awareness of the resources and be able to immediately connect them to those referrals. So here, I'm going to talk to you how the process goes from survey to referral. So the first step is the service provider meets with the family. They provide their own services, and through those services, they may uncover that the family is lacking certain needs or priorities. So the service provider will then conduct the survey to these families. And within that survey, the service provider will send out qualifying referrals with the family's consent to the programs to meet the family's priorities and needs. And what's really great about this One Touch platform is that it's a very quick system. It usually can take about 10 minutes to go through the survey, and that's starting the survey and sending out the referral for the family. So with this, I'm not going to go over everything with the One Touch survey, but just so you guys can have like a little sneak peek of what the survey consists of. These are some questions that the survey may ask. So they'll ask about home characteristics, moisture issues, if there's any pest issues or any lead paint conditions in the home. And based on how the family responds to these questions, it can lead to an automatic lead or healthy home referral to either Waterbury or the Connecticut Children's Healthy Homes Program. And it's amazing that just, with maybe 5 simple questions, that connect a family to a resource. And then another thing I want to talk about is a case study. And with this case, it really showed how partners within the platform can really collaborate. So this wonderful family. This family was connected to Building for Health through the state of Connecticut's Putting on Airs program. So the family reached out to Putting on Airs for help after noticing that their 6-year-old daughter, their asthma symptoms were getting worse. And they had really concerns about the health of their daughter, but also their other 2 children. So the Putting on Airs was able to provide an asthma education. But what they also found was that in the family's basement, there was mold issues. And mold can definitely be a trigger for asthma. So with this knowledge, the Putting on Airs was able to connect the family to the Healthy Homes program, which again, we're a Building for Health partner. So with the Healthy Homes program, we were able to remediate the mold issues. And it was not just in the basement, but also in the bathroom as well. And we were also able to address other concerns in the home, like installing a carbon monoxide monitor, as well as installing window guards in the second floor windows to prevent any falls. We were really able to help this family make their home safer. And then that did not just stop there. We were, the Healthy Homes program was then able to connect the family to a weatherization program run by HE Energy Solutions, which helped the family identify ways to increase energy efficiency in the home and reduce heating and energy expenses to create a healthier lifestyle. So this is what we really mean when the One Touch platform is a cross-referral system. The fact that we were able to have this family be connected through so many partners within the platform and make their home a safe and secure place. Now I'm actually going to hand it off to Luis just to talk about this section.
So thank you, Alba. So hello, everyone. So again, Luis Rivera, Community Relations Manager at Connecticut Children's. And so I'm going to take a step back. We heard a lot of wonderful things about the Building for Health program and the Healthy Homes, but I want to take a step back and talk about why we're doing this work. If we could go to the next slide. And we do this work because we know that living conditions, the environment, those are all social determinants of health. So this determines the health of our families in the community. So I am passionate about the community that we serve, and I'm passionate about the great program that we have in Building for Health, because it helps to create that stable and secure housing that our families need, because we know that without it, it'll lead to stress, anxiety. It'll keep kind of like some of the answers that you guys mentioned at the beginning, how it leads to cycles of poverty, not being able to have safe and secure housing. And if those healthy issues in the home is not regulated or helped to get fixed, it can lead to poor health outcomes like asthma or high lead levels. So that's why we do this work. If we could go to the next slide. I'm also in charge at Connecticut Children's Medical Center of conducting our hospital's community health needs assessment. And one of the things that came up through various focus groups and some of the surveys that we sent out into the community was the lack of healthy and secure and stable housing. So in having those conversations with families, they were stressed. They didn't know like if they were able to pay their rent for the coming month, or how they can fix some of their home health issues at home. So there was a lot of needs regarding health and secure housing. So that's why we're here, because we need you to partner with us in this great effort. So if we could go to the next slide. And if you are interested in partnering with Healthy Homes and the Building for Health initiative and helping mitigate some of these issues in healthy and safe, secure housing, please take out your phones, scan the QR code, and answer some of the questions that you will see there on Smart Sheets. And somebody from Healthy Homes will reach out to you to see how you can best partner with us in this very, very important effort. So with that is the end of our presentation. But don't feel sad, because it's the beginning of the panel discussion. So we'll have the panelists introduce themselves, and we'll start. Hopefully we're ready. I think that we are for the panel discussion. I know we gave you a lot of information, so now you get to digest the information, a lot of good information, and I'm sure that generated a lot of questions in you, right? So if you have any questions for our panelists, start thinking about it, because right now the panelists are going to introduce themselves, and then we'll turn it over for some questions that you may have. So I guess I'll pick on the first panelist, which is Chris Cochran, for him to introduce himself.
Hi, thanks, Luis. Chris Corcoran. I'm the manager of the Healthy Homes program here at Connecticut Children's. We're currently managing 3 grants, 2 from HUD and 1 from the Department of Housing directly to Connecticut Children's. And as has been mentioned before, our primary goal is making homes safe and healthy for families across Connecticut. I'm glad to be here.
All right, thanks, Chris. Our next panelist is Jim Horan.
Hi, thanks, Luis. I'm Jim Horan. I'm the Executive Director of LISC Connecticut. LISC is the Local Initiative Support Corporation. We're a national nonprofit community development organization based in New York City. I head up the Connecticut office with about 8 staff here.
And I believe our final panelist is Pam.
Hi, I'm Pam Wolf. I'm with HUD Energy Solutions. We're in the Energize Connecticut program. And we provide energy saving measures to lower energy costs and reduce energy consumption, primarily for income eligible customers in Connecticut.
Thank you, Pam. I think that I got all the panelists. If I miss anybody, please let me know. So I got everybody. Now, if you have a questions, feel free to raise your hand, and I'll ask you to unmute, and you can ask it. But while you're thinking about that good question that you want to ask, I have a question that was already submitted that I'm going to ask the panelists. And panelists, like, you can all answer it if you have a different answer. But if you don't have anything else to add, you can let me know, and I'll move on to the next question. So the first question: let's get into our time machine and go 1 year into the future. And I want you to tell me, how will success look like in a year for Building for Health? So in 1 year's time, what would a successful Building for Health program look like?
I can get started with that just to say that LISC has been involved with this program. We had a introductory period, and then it operated for 3 years with support from the Hartford Foundation for Public Giving. And the key aspect of this, as Scott said earlier, we were looking to help create safe, affordable, and quality housing with this initiative. And we really wanted to bring together the collaboration, the intersection of health and housing, which we did in this partnership with Connecticut Children's. And it really was a collaborative effort between the weatherization programs of the utilities, with HE Energy Solutions as the primary contractor, and then Connecticut Children's as the healthcare provider. And there were a lot of successes, and we also learned a lot of things along the way. But in terms of where we'd like to see this go in the coming year, we're really pleased that Connecticut Children's is taking it over. It's going statewide, which is terrific. We want to see the continued focus on urban areas where the need is greatest, and especially with the city of Hartford. And we had the support from the Hartford Foundation for Public Giving to do this. But in terms of that direction, we'd love to see more collaborations. I saw that one of the attendees today is Logan Singerman from SINA. We had a collaboration with SINA for its Walk to Work program to help people, especially in the South End neighborhoods of Hartford, get jobs. We'd love to see more of that. Putting on Airs as another collaborator. And we'd love to see more collaboration with the city of Hartford and other local agencies so that this is a cross-referral program through the One Touch program, and to see that grow. Just I'd like to add one more thing, that the One Touch system was put together by consultant Ellen Tone, and she was really key to making this whole program work. So I just want to acknowledge her efforts and the great work that she did.
Thank you so
Thanks,
much,
Jim.
Jim.
Yeah,
Oh, sorry, go ahead, Chris.
Yeah, I can chip in here too. And thanks, Jim, for mentioning Ellen's involvement in this. She's been a consultant working with Connecticut Children's, and many of you may know her name. She's been involved in the world of healthy homes and lead poison prevention for many years. And building on what Jim just said, one of the purposes for this presentation was trying to find additional partners. And we're located in Hartford, so we know the signers, we know the Center for Lead Teen Progress. We know a lot of the local organizations here in Hartford that would be likely going into the home visiting or helping the people that need our help too. So one of the things I'd like to see out of this a year from now, and maybe it's based out of this conversation and this panel, we have a presence like that in other major metropolitan areas across the state. So we don't know a lot of the local organizations necessarily in New Haven or out in well, Waterbury's covered because they have their own program, but let's just say Stamford, Norwalk. So it would be really great to find organizations that work in these local communities. It doesn't have to be the big cities. It doesn't have to be a Bridgeport. We'd be happy to be doing more work in Middletown, where Representative Williams was speaking from earlier. So that's one of the things that would be a great success, having a bigger footprint within these communities, because one of the purposes of the work we do with the Office of Community Child Health that Scott alluded to is when we build something successful, we like to make it something that's we can replicate in other areas, in this case, across the state of Connecticut.
Thank you so much, Chris. So yeah, partnerships, very important, right? When we're looking into the future, being able to add those new partners and being able to expand the services throughout the state to other towns, very important as well. Before I move on to the next question, I just want to see if Pam, is there anything else that you would like to add? Just want to remind you that you're muted.
Yes, I'm sorry about that. Yeah, I think a success in a year from now is being able to, especially with our program, reaching these families that wouldn't normally be able to have the benefits of what we can offer as far as, upgrades and energy efficiency in their homes, but having the ability to have these unhealthy barriers be able to be removed. And I'm finding that we're just growing every day when it comes to this collaboration. And, I think to see in a year that we're reaching even more homes than we are now will be a really successful story. And I think we're gonna get to that.
Thank you so much, Pam. So I'm going to move on to our following question. And you guys talked a little bit about it already, about the partnerships. And so my question is, how has the collaboration between partners been successful? So I know that, Jim, you mentioned SINA and some of the collaborations that you've done there that were successful. Any other examples of successful collaborations that you could share?
Well, okay.
Yeah, go ahead, Pam,
Go
please.
ahead.
Sorry.
So I know that we've had a success story that has been amazing for a family that we had in Terryville, where asbestos and mold removal was done by Healthy Homes, and we were able to provide insulation, windows, heating systems, hot water heaters, new refrigerator, and it really was a huge success for this family that wouldn't normally be able to afford any of this. And what happens with our program is if we have stop work order barriers such as mold or asbestos, it's so wonderful to have an organization that can take on that for us so we can go further to help the family in energy efficiency.
Yeah, I'll just say, like, the basic coordination between the utilities through HE Energy Solutions as the vendor and Connecticut Children's. Just that alone to start with was really terrific. And earlier, Alba had the slide from Maria Guzman, who is involved with this program. And I know that Maria, when she was working at CCMC and helping to coordinate it, was so thrilled that there was finally this coordination that helped people access resources that they need. And I think growing to include other collaborating agencies, there was the example from Putting on Airs as well, but to add more and more agencies so that this cross-referral system is providing a lot of free services to people who really need it to make their homes safer, healthier, more affordable, it's an amazing outcome, and we need more of it. It does require care and attention to make it work, and I think Connecticut Children's is in a great place to make that happen.
Anything from your side, Chris?
No, Jim and Pam did a good job describing the successes. And again, we're just looking to build on that. You know, when we think about especially with home visiting programs where people are actually in a home and they're seeing opportunities to either help with energy efficiency. You know, if you're in a home in the middle of winter and they're only heating 2 rooms and there's 6 rooms in the house, that's an issue. You know, if you see black mold in a ceiling and there's a kid with an elevated level of asthma, visits to the ED, that's the reason to get, you know, healthy homes in there. So, and we can also be working with our current partners, but looking for new partners is our big goal for the year.
Okay, so we have a, thank you for that, Chris. So we have a question in the chat, so I'll read it and feel free to look it up too, so you guys can read along. It's from Logan Singerman from Sina, and his question is: at one point, there were certain zip codes that automatically qualified for the income qualified energy efficiency upgrades. Is that still the case?
Yeah, I know. I'll say when we started the program, it was concentrated on the Frog Hollow neighborhood of Hartford, and it quickly expanded to other neighborhoods in the south end of Hartford. And then pretty early on, almost every neighborhood in the city of Hartford, with the exception of, I believe, downtown and the west end was included. And those automatic qualifications for people living in those neighborhoods continues, I believe, but I don't know if other neighborhoods have been added or if Connecticut Children's could set it up to do the same in other cities.
Pam, do you want to speak to that?
Yeah, well, UI right now is doing, and their entire territory is or not the entire territory, but certain neighborhoods in their territory are having you know, zip codes where everybody will fall into our income eligible program. They actually have sort of they have a map where you can click on to where I don't have it now to share with you, but they are running a program just like that, where they're have these you know, neighborhoods and blocks and neighborhoods where they are providing with no application, you know, they're already eligible.
Right, and from our purposes, it was a good question. Thank you, Logan. It's census tract approval is something we were able to obtain through our grant directly with the Department of Housing. So it was a very important move for us, especially in multi-unit buildings. Now, our multi-unit definition is 2 and more. The utilities definition of multi-unit is 5 or more units. So even if it's 2 or 3 units, or if it's in 30-unit building like the building we're in New Haven right now, if we're able to go in and say every single person in this property is automatically qualified because of the census tract they're in, we don't have to gather any income documentation from those tenants and occupants. And that saves a lot of time, especially times 30 units, but even times 3 units helps the process move along a lot farther. And that's one of the key things about building for health. And another thing I think that I would say would be a success a year from now is tightening up our timeframes. So when we get a referral in, if it's coming into us to remove health and safety hazards like asbestos, for example, how quickly can we get it over to the asbestos abatement contractor and then back to the energy provider, in this case, to do their weatherization, because asbestos hazards will stop weatherization in its tracks until it's abated. And so I think that's where, when we're able to, anything we can do to expedite that process, and certainly gathering income, because that oftentimes involves collecting copies of tax returns or pay stubs, and people are more and more hesitant to even share that information even if it's easily accessible, which it isn't always so.
All right. Thank you, Chris, for that, and thank you, Logan, for your question. Any other questions? Feel free to add it to the chat. Also have another question here queued up, which is, do you have any tips for future partners? So any lessons learned that you can share with future partners so they could be successful in partnering with you?
Well, I know that we had tried to get the City of Hartford Health Department as a partner, and the timing, we didn't talk much about this, but COVID made a lot of things difficult because a lot of this was gotten started right before COVID, and then COVID hit, and because this was in part a home visitation program, that made it difficult to do. Same thing for trying to partner with the City of Hartford Health Department, because it had, its attentions were hugely diverted to vaccination and helping people get early on in the pandemic to get the masks and other protections that they needed. So that was difficult. But I think if it's possible to partner with local health departments, that can help a lot.
Yeah, I think that's critical. Again, wherever we can get the maximum, likelihood of being in the homes that need these services the most. Local health is certainly a great resource for that. And like I mentioned earlier, home visiting programs. So I would say if it's a new partner coming into the program, the key things would be, number one, to understand the benefit of the program. And so that's where we need to be a good job of training our new partners about what exactly we can do. And also, almost more importantly, what things we can't do. We cannot solve all the problems of homes that are coming to the program. For example, if a home has what's called knob and tube wiring, which is a very old wiring system, it's extremely expensive to replace that and bring it up to code. Our program cost won't cover that. On the other hand, if we come into a home and there's a boiler in the basement with asbestos on the exterior, and it's hazardous asbestos, because not all asbestos is considered hazardous. I won't get into the details of that. We can go in there and take care of that hazard. So the front end education, and then on the behalf of the referring partner or the service provider, to make sure their staff also are fully aware and really committed to understanding the benefit of it, and then who to refer and when. That's where we have some of our challenges. And so again, it's a great way to just illustrate it's a partnership. We want to be successful because we're going to find units where the weatherization program really wants to get into. When we started this work back in 2009, not under the banner of Building for Health, but under the banner of Weatherization Plus Health, and that was an initiative that launched because the weatherization back then, it was just the utilities directly more so. They were always trying to get into low-income multi-unit housing, and that's where we were always in. So how we can help them get new clients and how new clients can come to us through the services being provided by our partners is a win-win for everybody.
Thanks, Chris. How about oh, sorry, Alba, go ahead.
No, I was gonna add another tip I would say is just understanding that communication within the partners is very important as well. It's not like, for example, I can just send out a referral and then that's it. I don't do nothing with it. I know I have that communication, that relationship with, let's say for weatherization, where I can reach out or they can reach out to me if they want an update on the status, or if we're having issues communicating with families, we're able to work together and really do all we can to support and provide for the family.
Thank you, Alba. Okay, so I have one more question here. So are there any policy change that is needed in order to make Building for Health successful? So any policy changes that we need to make Building for Health successful? We have a room full of policy advocates, so they're going to fight for us. So we want to make sure that they know what they're fighting for. So
I'd have to go back and look exactly at this, but policy was an element when we were looking at the whole Building for Health initiative for LISC. And one thing was that we looked to influence CHFA's QAP, the Qualified Allocation Plan for Low-Income Housing Tax Credits. And I think there is something in there now, not necessarily because of our efforts, but that this was done, that awards extra points for smoke-free housing, because that's just a huge factor, especially in multifamily housing. Even if somebody in an adjoining unit is a smoker, that can influence the people in the units around them. So that's something, but I think that may already be done. There's probably people on the call, the folks that are attending today, that already know what's been done. But that is one policy change that we were looking at.
Thanks, Jim. Any other?
Well, Luis, it is the classic breaking down of silos to some extent, when we're going into a home and our regulations require 80% of area median income, and this state's utility program requires 60% of state median income, and maybe another provider requires 100% of poverty. How do we kind of level that out? So we know people living, especially if it's a census tract, low income tract, we know the majority of people there deserve these services, they're income qualified, and how do we get to them? So if I'm able to go in and census tract approve it, but one of the other programs is somehow prevented by policy from going in because they have to get different level of income, or they have to get specific documents, where there's abilities to say, let's make this easy process, because what we're trying to do is help the people of Connecticut live in safe and stable housing, right? Especially for us, families and children with families with young children. So anywhere we can, start to build on that. I think that's another thing we would probably be looking to do into the next year or 2 years, is how do we look at that policy angle and bring together the stakeholders that matter and that know this world the best, because the policy holder or the policy analyst from the hospital's point of view is a little bit different than the policies that would be needed to be changed or looked at for this particular initiative. So getting people who may be on the call today eventually to sit in with us and figure out what are the policies that I defer to what folks on the audience think are important policies to change to help facilitate a program like this.
Yeah, so if you have any idea, any thoughts on that, feel free to drop it on the chat. Before I go into the question that I see in the chat, I want to give a chance to Pam in case she wanted to weigh in.
Well, I agree with Chris. I think that, it should be, the application process should be straightforward through all programs, and our requirements are different than theirs, and I think it would be beneficial to everybody involved to have this more streamlined. So I completely agree. I think that is one thing that really would need to change.
All right, thank you, Pam. So we have a question here from Heather. And Heather, if you wouldn't mind, if you could put what organization you represent. I want to highlight that because you asked a question in the chat. So I want to highlight you and your organization. And while you do that, I'll read your question. Oh, but Chris answered it already. So we're good with that. So thank you, Chris. You're ahead of the game. All right. So those were my last questions. I'm going to take a pause to see if there's any others.
Yeah, if I could, I just would like to respond in part. I think it would help to clarify Heather's question as well, to say that the one-touch referral system, the intake system that Ellen Tone, the consultant, developed, had a series of questions that were asked of the tenant or owner of the home. And by answering those questions, it helped to populate to figure out what programs they were eligible for. So that was kind of like behind the scenes and something that's really terrific about the one-touch referral system.
Thank you, Jim. I see we have another question from Logan Singerman from Sina. His question is, can the healthy homes be used for a home that is vacant and being renovated?
Good question, and it's a bit tricky. Our money prohibits us from working on what's called gut rehabs. So if it's vacant and there's no utilities and we're stripping down to the studs, then no, our money would not be able to be brought in. However, if it's a vacant building, utilities are provided, And that's part of that is our need to be able to get our staff in there safely to do the assessment and develop the scope of work, and then for our contractors to, again, safely be able to do the work, and not just safely, but physically. We need to have light, heat, water in order to work on a project. So yeah, vacant units actually obviously are ideal units in that there's no one to relocate, there's no income to qualify. They're kind of a cherry on the ice cream sundae maybe of units out there. But we also are always very interested in working with properties where there are children in residence. It's actually a requirement of some of our HUD funding. And HUD, quite frankly, is not a big proponent of working on vacant units, but we're not prevented from doing so. We just have a target to be working. But we always understand that when we're developing a vacant unit into a safer, stable, more stable, quality house unit, whatever it happens to be, there could be children moving into in the future. And again, Connecticut Children is not surprising. We're focused on children's health, but also the health of the families and the children's all around the neighborhoods.
Thank you, Chris. All right, any other questions? So I'll pause for 30 seconds just in case there's any burning questions that you want to type up. And then if not, then I'll begin to wrap us up. So seeing no questions on the chat, I want to thank everyone for participating in this Building for Health session. I hope that you found it very informative. And as you hear, there was a theme here that we're looking for partners to partner with us in this great effort. So I'm going to ask Alba if you wouldn't mind sharing the PowerPoint presentation on slide 22 so that we can see that QR code one more time. And so we're in need of partners to continue this great work. And if you wouldn't mind scanning that QR code so that you can sign up to hear more about our program and seeing and identifying ways that we can partner together in this great effort. So I think if Alba is still there, we will have that QR code posted. Awesome, thank you. So yeah, feel free to take a picture of that and sign up. But with that, thank you so much for participating in this session.
Thank you all.
Thanks, Luis.
Thank you.
Thank you all so much. This has been a really, really wonderful session, and thank you for an amazing conference. This is our last session. I just dropped in the chat that our 4 p.m. session is postponed due to speaker availability. So we're going to end on the high note of this amazing presentation. So thank you so much, and we'll look forward to seeing you all in November of 2023.